She had Richard talking about the thing we had. We're just experience in high school. Okay, some of her thoughts and ideas. And he said he was going to help out and say about it. So. Yeah. Okay. Let's talk after the meeting. Okay. Normally. Are you okay if I just go along? Email. Sure. Sure. Okay. That's great. Wait, you want to shows up real quick afterwards?
I can move by you, or you can come move by me. You can sit by me.
How are you? I'm good. Good. Cook. And isn't funny? I was actually after the practice that we had out myself, and we all say cooks. Until they want to sell and making sure when it's selling training. I don't know what's wrong.
Daughter worked for it, and when she talks to me, she says, well,
My husband always thinks it's true if I say it.
I'm like, well, no, you read it, it was cooked.
It's the name of someone, so that's why they're like, but in my head, it's like, what if it was, what if her last name was Peterson? If they went to Peterson's hospital, let's do
That's what it sounds like.
Yeah, so my husband always makes fun of me too, because it was an abrupt change in our house, and so he's like, oh, I'm cooking.
Yeah, that's so good.
Okay, I guess we'll go ahead and get started. And then if people come in, they can come in and join us. So welcome to the Shack meeting today. We have several things on our agenda. So first, we have a really special treat. Are you good to go first? You are? Okay, we have a very special treat. We have a high school student that's going to give a presentation on Narcan. We've talked a lot about Narcan this year and really just gone over and over and over it because it's such a big deal in today's society, and it's become such a problem and an epidemic, and it's something we need to be aware of, and our schools are aware of it, and we just need to be on top of it. So if you want to come present your Narcan demonstration, that would be great. Okay, and remind me of your name again.
My name is Abby Fisher.
Abby Fisher.
She said she'll stand by for you.
I have to pass the pills.
Okay, here, I'll do this. I'll move this so we can see you too, because we've got several people on Zoom.
What these are salt and sugar pills. I'll explain what we're going to do for just a second. Don't put them on.
They're little.
And this is a case report that actually shows just recently that one of the guys was charged with attempted murder because he gave his friend pills that had fentanyl on it.
She's trying to figure out which one's which.
She's like,
heard.
So the reason that we went ahead and did salt and sugar pills was actually because you don't know which one you're grabbing. You don't know if it's salt, you don't know if it's sugar. So salt is going to represent if it had fentanyl in it, and the sugar is going to represent if you got a normal pill. Now, they were just in a thing, and all of you grabbed one from the exact same container. Go ahead and take your pills.
They just dissolve
Just
on your
put it in
mouth.
your mouth.
Yeah,
They dissolve.
they dissolve on your tongue.
Yeah.
You got salt?
Yeah. So all of y'all that got salt, you just OD'd. Yeah.
And now you need Narcan.
The sugar sure dissolves a lot faster. So that's kind of what we did for visual representation. I'll actually be doing this at my high school as well, and we will be passing out those pills for them. And we also have this for you. So the white is going to represent just regular pill powder, and the brown is going to represent fentanyl. Mix it so you think that it's completely mixed.
Oh, I'm sorry. I thought
Oh, you're good.
it was monopoly.
Y'all all get to mix it. So y'all think it's mixed. Y'all can go see if you want to mix it some more. Y'all think that's pretty mixed?
Well, I want this.
Yeah. Alright. So I've had y'all mix this. Y'all all agree that it's mixed, right? Yeah. Alright. Looks pretty mixed. So what we do here whenever we're pulling this apart, it's to represent different pills. We chose white sugar and brown sugar to really help show the students what exactly it is that they're taking. Because whenever you take a pill, it all looks the same, yes, but you don't know if it's fentanyl. Same as those salt and sugar pills. You didn't know if it was salt, you didn't know if it was sugar, they all look the same, coming from the same thing, and some of y'all didn't OD, but some of y'all did. I'm gonna walk around with this. Y'all can see that over here it's got some more white in it, but over here it's got some more brown. So y'all all mixed it. Y'all think it's mixed? Yes. But even with y'all mixing it until y'all were content, until every single one of y'all in this room thought it was, there's no real way to truly mix it. So while some of you may get a pill that you won't overdose on, you just have to get hospitalized. Some of you may get a pill from the exact same batch that you'll do overdose on, which is what this case report shows. A guy bought some pills, and he gave it to his friend, because him and his friend were trying to get high. And in that case report, it shows you how much he had to pay, and all the different things that he had to go through, and he was charged with attempted murder. The pill he gave his friend had fentanyl in it. He did not die. His friend, on the other hand, he did. So he went to jail for a very long time and had to pay a lot of money. You never truly know whether you're taking a pill that has fentanyl in it or not. Same as you didn't know which one was sugar, which one was salt. You tried to mix this. Manufacturers can try and mix it. And surprisingly, fentanyl is really easy to get a hold of. It's really easy. And a lot of students don't understand what they're doing when they take the pill. I'm Pretty Mad, and for my project this year, I'm trying to help show students what they are doing when they take a pill. One of the main things is education. Education is key. They have to know what they're doing, what they're getting themselves into. Because a lot of kids, they show up and their friends like, hey, take this, it'll make you cool. They take the pill. They don't know what they're doing, but then they might OD and they might not make it. All because their friend said, hey, take this pill.
So tell us how often you get to present to the student body.
So at my high school currently, we are actually doing it to every single one of our students. We have our science teachers. I taught my teacher how to do this presentation. It takes about like 10 to 15 minutes at the beginning of her class. It doesn't take long. But I taught her how to do this. She gave me some pointers. She's actually the one that thought of salt and sugar pills to pass out to the class. I got this case report to pass out to everybody for everybody to read in class. And she is doing her presentation for all of her classes March 1st. That is our first presentation. Whenever she is done with hers, we will show the other two science teachers how we did it, what we want them to do, and they're going to present it to all of their students. And I'm going to be the one doing it with my principal to all of our seniors who do not have science class. This way, everybody's getting the education, and it's something that takes 10 minutes, not long. It's educating them. It shows them visually what it is. They get to taste the salt and sugar pills. They don't know which one's which. So it's really just a good representation of it, and that they don't know what they're getting into, whether they think they do or not.
Very good. Awesome. Thank you so much for sharing. Definitely need more of that. That's awesome. So do you want to present, or do you just want me to tell what you brought? How would you rather?
I'll just pop.
Okay, perfect. I love that. Yes. Okay, so we have Misty Clark from the Hood County Substance Abuse Council, and she's going to share with us a little more about some fentanyl and fentanyl issues.
Okay, so on that report, that is a local report that happened in our county. I have been trying to get statistics for our county, and I can get them for Tarrant County, and I can get them for Texas as a whole, but I've had a pushback with trying to get them for Hood County. We're trying to get Narcan into the hands of anybody that's working with our youth. I come from substance abuse, mental health, and then now I am just trying to promote the prevention and other people in our community who support the recovery of it. The thing is the gap in between. So prevention is key. That's what we want to promote more than anything. And then, of course, we believe in recovery and a healthy community, and we have all those in line. What we don't have is people wanting to understand that Narcan can save a life. Like Abigail said, we have kids who have no idea that they're taking fentanyl. It is a poison. As a mother, I asked myself before I could promote Narcan was, okay, how can I promote Narcan where people aren't thinking I'm promoting that it's okay for them to use drugs? And so I was telling my PCP that I was struggling with that, and she said, how many years have I told you were pre-diabetic? And I was like, I don't know. Well, now I'm diabetic. I'm 41, and I never cared that I was overweight. I never cared, and I knew the whole time that I was pre-diabetic. Well, insulin has made me better. The weight now I will work. It took me that long to wake up to realize that, okay, now I need to lose weight, and now I'm 41, and now it's harder, but I didn't care until then. Well, if I didn't have insulin to help me be healthy to where I have the chance to lose weight, I couldn't get better. Same thing with Narcan. So it's not saying, hey, do drugs and we can save your life, because you're still going to have the effects of what a drug can do to you, what can happen to your body, even if they can bring you back. The law of what you did, like there's consequences still with the issue of what was placed in front of you. However, when you hear a mother tell you the story that her 16-year-old died of fentanyl, because he took an Adderall because he wanted to pass a test in school, and he thought that that would just simply keep him awake, then you're like, okay, well, as a mother, and I want to prevent, how can I prevent without these stories, without letting them know that, yes, it does happen to children who really didn't think they were gonna die? Or am I gonna promote, yes, my kid is in jail and I'm going to visit her every weekend that I can, and she took fentanyl and she survived because of Narcan, but I'm here to tell you the story that my kid's facing these consequences, and we are dealing with it as a family, as a community, and it's not shameful. Like, I still love my child, I still go to visit her, but the other mother's story was very different than mine. So it's important to know that this is not a promotion to do drugs. There's boxes, it's locked up just like you would anything else, any other kind of medication or life-saving things that we have around our schools. And it says that it's emergency overdose kits, so it's for emergencies only. And it's just something that I think we need to make sure we have with anybody who is working with our youth, because at 16, I know I didn't make the best decisions, and I can't say that at 16, that I even know a 16-year-old that makes perfect decisions. I didn't make it at 41 until 5 years after being told I was pre-diabetic and finally facing the facts. So just the prevention is key, yes, but in order to promote prevention, we have to have those stories, those statistics. And so if you need Narcan or you need a box, let me know and I will get them to you. And Abby, you did a great job in showing your demonstration of how easy it is to not know what you are doing. So.
We are so appreciative. We've worked really closely with Hood County Substance Control Abuse Center this year, and we're so appreciative of their knowledge and just training us and helping us and donating. They're now donating all of the lock boxes to all of our schools so that they're by the AED machines, and we have those readily available as well. We've had them, but the nurses have been keeping them in their drawers, and now they're going to be all around the schools in those boxes as well. Next, we have telemedicine from Cook Children's Hospital. They're going to give us an update of how we use them as a district and some of the numbers of what we've done this year so far with working with them. So welcome. Thank you guys for coming up.
I'm Holly, and I am the nurse coordinator for our telemedicine program.
My name is Jeanette. I'm the office supervisor for the school-based telemedicine and basically all virtual.
My name is Carrie Lipscomb. I am the director of operations for our program.
We were just talking, we think that Granbury was actually one of our second or third schools to ever come on to us. It's definitely grown along the way and kind of found its path at every school that we're in and where it fits in and how it's going to be used. But when we come into a district, Cook Children's actually takes on the cost of bringing basically a remote doctor's office into your school. So your nurse is given a stethoscope, which this is it, it's called the echo stethoscope, that they can connect to. So when the nurse is listening to a chest, our nurse practitioner or physician, whoever's seeing them that day, can hear what the nurse hears. And we also give them also give them an otoscope. So if they've got an ear infection, they can put it in the ear, and a visualization of exactly what that nurse is seeing is on the screen for the provider to see as well as the nurse. So it's a really awesome program in that our system was able to set it up like a doctor's office. So if you don't know about doctor's office billing, they bill at a much lower rate than say an urgent care, but it's an urgent care. They're seen more on demand, and we didn't set this up to take away anybody's ability to see their PCP, because we still think that a relationship with their primary care provider is important. But it does mean a ton of kids in the gap that you've got a working parent that can't get off work to get them there, or you've got a kid who's crying because their ear hurts so bad that their doctor's office doesn't have an appointment for 2 days. And the other option would be go sit at the ER and pay thousands of dollars for something that we can see very quickly. It's a very quick visit. We take insurance, we take Medicaid state-funded insurances, and of course, we do self-pay and we bill at a discounted rate if they pay in full.
All of our registrations are done online. The parents, it takes anywhere from 3 to 5 minutes for parents to fill out that registration. And the majority of them are done the same day, just because it's so quick that the parent can fill it out really quickly. We get it, we register them in our EMR, and then we let the provider know, hey, they're ready to be seen, kiddos seen. They get a prescription called in. Half the time, if they get that prescription the same day, they can return to school the following day. So this school year, Granbury ISD has seen a total of 22 kiddos, with Acton Elementary being the highest one. They've seen 14. Oakwoods has seen 4. Acton Middle has seen 1, Bronner 1, and Granbury Middle 2. 6 of those visits had positive strep tests. So the majority of them were able to get that prescription the same day and come back the following day. 7 of those were negative. They stayed in school, got a school note. And then all the other visits were ear pain, rash, and lice. Lice is an easy one. Get that prescription called out and we get that kid treated.
It's awesome. Thank you so much. Very informative, and it's a very great tool for us to have, for our nurses to have. We have several nurses in here that I know that are very appreciative to have that. Okay, so this is the last item for today's SHAC meeting, and I'll just I'm gonna read it. I think our Zoom is getting close to running out. If it runs out, I'm so sorry, but I've got 10 minutes. Okay, so I'm gonna read really fast, but here we go. So as you all know, SHAC is a group of individuals that are selected to advise the district on coordinating school health programming and its impact on student health and learning. SHAC provides an efficient, effective structure for creating and implementing age-appropriate sequential health education programs and early intervention and prevention strategies that can easily be supported by local families and community stakeholders. That's a little bit about SHAC. So last year when the health TEKS recently changed, we met and we reviewed all of the new presentations and curriculum, and then the board approved for all of our new health education programs, which actually will be in adoption now for the next 10 plus years until the next adoption cycle comes around. So we're not wanting to change our program, but we are proposing an opt-out of SHAC and proposing that we move our health needs and education needs to our district advisory council, which is called our DAC committee. This would change and allow members of the DAC committee to address our district health needs and education needs as they are aware of the district needs and our student needs. This would also consolidate the number of meetings and the number of committees that are required by law and would better help serve the community. So the DAC will convene, similar to SHAC. They meet at least 3 times a year, sometimes more if they need to address these needs and many others. So this is the legal part of it all. So just kind of stay with me for just a second. So House Bill 1525, which was passed in the 87th legislative session, did not change the applicability of Texas Education Code 28004. In reference to charter schools or districts of innovation that have opted out of this section have not listed having SHAC in their district of innovation plan. So if all of you don't know, we are a district of innovation at Granbury ISD. So the changes made to House Bill 1525 and to the TEC 28.004 do not apply to schools of district of innovation or charter schools. So the Texas Education Code 28.004, which discusses local SHACs, does not pertain to public charter schools. Thus, it would not be required for a district of innovation. This will ultimately be a decision that the board would make. Our school board will make this decision if we approve to move SHAC to the DAC, but we are proposing that. So what I would like for us to do, and you guys online, I would love for you to email me and let me know what your vote would be. But we're going to vote on keeping SHAC as it is, where we meet at least 4 times a year, or opting out and do as a district of innovation and moving it to the DAC committee and having a steady agenda item with them to talk about all of our health issues and needs that we have talked about all year long. So I'm going to give everybody a voting form if you're a voting member, and if you will vote and give those back to me, then we will present that to the board, and I'll reach out to everybody that's not here at the meeting as well. And otherwise, after that, this is our last meeting for this year, and then we will decide next year whether we're going to be meeting again as a SHAC committee or a DAC committee. So thank you all for your participation, and you guys online, I'll see you. Yes.
I just have a question.
Yes.
So the DAC committee, do they have, how big is their agenda usually when they meet 4 times a year? I just wonder, like, when we have some of the presentations we have here,
Right.
that take a little bit longer, but I feel sometimes they're important, you know?
Yes.
If they'll provide time for that, if they will be able to view those things and stuff, that I think help you decide whether it's appropriate to take them to the school or not, which most of the time they are. But I just kind of wondered, I don't know what the DAC committee encompasses, so I was just wondering.
Tammy, you want to touch on that?
So that, often they'll do changes like our calendar. They are the first people to see and discuss the proposals that we're gonna push out to everybody to talk about calendar, for example. There's a regular instructional update for that. Usually the meetings are about 30 or 45 minutes, so they can easily encompass something like that and make it a little bit longer, but everybody's already there. So, it's a feasible thing to do. It's just, do we want to have that there? And really, we're just gonna propose it to the board. Do we wanna keep meeting as a group, 4 times a year here to discuss some of these things? Or do we want to say, we're gonna push that as an agenda item to the DAC and have those 4 meetings? And then go. So that's really, it's really about involvement, right? And we know that we ask everyone to be involved in everything they can all of the time, and it's usually the same people who are willing to do all of the things. And so that's really where the spirit of this decision, right? If you want to keep on bringing it together, we're certainly willing to do that. But if we want to consolidate meetings, we are certainly willing to do that as well. Because we do appreciate the people that turn up every single time to have the good discussions that we need to be having. It's just, if we consolidate them and be at the same time, and sometimes substance too. That's really what you're voting on today. Yes, there's time in the agenda for that meeting to go to an hour 15 and that instead of 30-minute updates.
And you all probably have noticed too, our first meeting, we had a ton of people here, and then it just has dwindled and dwindled. We have 5 here today and 3 online. So I know it's difficult to meet for a lot of people, and just taking that time out of y'all's schedules. And so we thought, well, that this is a way, and since we had adopted the TEAGs for the health, and that was a really big thing, the rest of the things that we've covered, which has been a lot of Narcan trainings and things that we thought, those can easily be incorporated in the DAC committee as well. So anyways, you guys vote and let me know what you think. And the rest of you don't get to vote. I'm sorry because you're not a voting member, but we're so glad you're here.
Still be a part of it.
I was like, there's not very many people who know what that is.
I didn't graduate from there, but that's where I went to school.
Oh, there you go.
I graduated.
I got only graduated from the college station.
And my email is.
Right, for sure. Oh, I need one.
Nice to see you, Leah. I love you.
Coming to the DAC meetings, it would just be.
Right, unless you have something to present within the SHAC agenda.
Everybody's at Granite, so he'll
Yeah.
let down.
I just didn't know how to do that.
It's the game out. That's what I told her. I was like, they're like actual adults.
And they presented all at a party and everybody's taking this in case the same dealer at the same time.
There you go. Thank you. And you're from, I'm sure.
Yeah, so we just, thank you so much for doing that. You do such a good job. It's very, very brave of you to do that. I don't know.
And we still get to keep our same presentations that we were doing.
Yes, they don't have to show to the, they are supported.
Right, this was a group that pushed them.
I didn't have to do a lot of time.